Assalamualaikum warahmatullahi wabarakatuh. My name is Putra Hemas. I'm from 2A grade. I will reading about respiratory. The title is Update the Influenza Vaccines Advice Target Protection of the Elderly and Health Workers. Health. Amid a potential global shortage in influenza vaccines and the ongoing COVID-19 pandemic, the UN Health Agency has advised countries to protect the elderly and health workers first. The updated recommendations from the World Health Organization or WHO come as the Northern Hemisphere brands for national bugs, which claim the hundreds of thousands of lives from respiratory-related causes every year. This has in fact been an infectious demand, and we are hearing now that countries that are trying to get influenza vaccines cannot get it, said Dr. N. Moon says Chef Influenza Preparedness and Responses at the WHO. The aim of the announcement by Strategic Advisory Group of Experts on Immunization or STIC is prevent national health care system from becoming overwhelmed, and to prevent confusion, the treating people for respiratory disease that can be difficult to tell apart. Dr. Moon told journalists in GFEMA state appearance, based on asset considerations, including alleviating the aided branches, the healthcare system, and vulnerable population, and managing potentially limited supplies of influenza vaccines. STIC has recommended among the 5 risk groups that health workers and older adults are highest priority groups for influenza vaccines during COVID-19 pandemic, he said. For years, STIC identified 5 vulnerable groups: pregnant women, the highest priority; children, older adults, those with underlying medical condition, and health workers, in no particular order. If possible, all these groups should continue to be vaccinated as the best way to reduce disease, Dr. Moon said. Adding the measure been in place for 50 years with no known adverse side effects. Cure for killers. Although the influenza jabs would not protection people from coronavirus, a new disease for which there is so far no cure, it keeps you out of hospital, he continued. The WHO official noted the national influenza affects individuals in every country and result in up to billion cases. 3 to 5 million severe cases, on average 290,000 to 650,000 deaths, respiratory-related deaths annually. Indication that There might be potential influenza vaccine shortage take back to April. When countries place order with pharmaceutical manufacturers conscious of the increased bandwidth that the COVID-19 pandemic may place in their healthcare system. Annually, around 50, 500, 500 million doses of vessels of produce, responding quickly to increased demand for inoculation can be related response. Dr. Moen explained as the most common way to produce involves large number for chickens egg. We have we have heard that from our industry association that they have been able to increase some of orders for some other countries and they've made additional vaccines that they've been handing out. But overall, it doesn't seem to be there is a higher demand that there is number vaccines. Thank you.